After my degree in urology, I started my surgical experience at the Center for Urethral and Genital Surgery in Arezzo. I am always fascinated with reconstruction because it is a surgery that leaves space to creativity. It requires a broader knowledge of plastic surgery and urologic surgery, but first of all the patient counseling, because the reconstructive urethral surgery depends primarily on the patient's goal. It's a fine surgery and requires a precision to restore urinary flow, preserve the patient's sexual function, and improve aesthetic aspects. When I started 15 years ago operating in this niche urogenital surgery, my goal was the same as many other surgeons: learning, practicing, updating, to give patients a better quality of life. Perhaps more than other colleagues, urogenital surgeons are an even smaller group of specialists, since in our case the pathologies are less widespread. But in any case, the suffering of patients are not less serious or less disabling. During this year, I have seen that in Italy and abroad there is a lack of specific training path in reconstructive urogenital surgery, especially for surgeons with specialized in urology. Moreover, the traditional training path through fellowship abroad requires a lot of resources in terms of time and money. Because of this, it happens that many patients do not receive the correct treatments, such as the widespread practice of dilation and repeated ureterotomies that cause pain, increase of urethral damage, and give only a temporary solution. I had never given too much attention to this feeling until I recently decided to do something. Although I am not an expert in teaching, although the language barrier may be a limiting one, even if other colleagues may not agree with my initiative, I decided to take the first step, starting from realizing online training path with the aim to support many urologists at the same time by highlighting good practices and complications to be avoided. But there is something more in this training that I am performing. In my medical career, I have always tried to improve myself and learn innovative surgical techniques that could lead to new benefits for patients and further improve their quality of life, and thus always stay updated with the natural evolution of medicine and technology. A big chance occurred in 2019 when I had the opportunity to discover the existence of NanoFat, an ultra-purified adipose tissue rich in adipose-derived stem cells with high regenerative property. I immediately became interested and deep in this new approach based on tissue regeneration rather than on the replacement of pathological tissues. I have studied and used NanoFat in a lot of urogenital pathologies, and the results achieved until now are very promising. For this reason, I started together with several colleagues the Italian Center for Urogenital Regenerative Surgery, and we are not the only ones who believe in the future of this surgery. Other eminent colleagues from other countries are joining us to multicentric studies, and soon we will be able to create a multicenter research with the aim of finding new treatments for other regenerative urogenital diseases.